Ich habe an gar nichts gedacht erstmal.
At first my mind just went blank. I was numb, as if I'd been anesthetized. I was in shock.
Ich war schockiert. Also ich war zu Hause, ich kam von der Schule.
I was at home. I just gotten back from school. I'd picked up the kids from kindergarten and got a phone call.
Und ja, es war eigentlich nur so ein kurzer.
It was just a short message. Mama has cancer. I was here alone with the kids and I couldn't just stop crying. I was just in shock.
Ich war erstmal nur geschockt.
Ich war im Januar 2005 zu Konzerten.
In January 2005, I was in Athens doing concerts with my father. One evening we were invited to dinner, a wonderful, rich Greek meal. And suddenly I felt dizzy, which is unusual for me.
Plötzlich schwindelig, was ich eigentlich nicht kenne. Mein Gefühl war wirklich, glaube ich, auch richtig.
My feeling was right, I think. I said, no, call an emergency doctor right away and get it checked. Something's wrong.
Also mein Leben vor der Krankheit war...
Before the illness, singing was at the center of my life. And from one day to the next, that life was over.
Beendet.
And then I got a diagnosis. Ovarian cancer.
Eierstock-Krebs.
And I sat there and I thought, is this for real or what?
Falschen Film.
Ovarian cancer is not a common disease. One problem with ovarian cancer is that it often goes unnoticed for a long time. That reduces the chances for successful treatment. But in recent years, there have been enormous scientific advances making it possible to treat ovarian cancer much better than before. In Germany, some 8,000 women are diagnosed with ovarian cancer each year. Despite this life-threatening diagnosis, the results of treatment for ovarian cancer have been greatly improved in recent years. Fear is the central issue here. But we know that educating patients and providing them with information can significantly reduce their fear and improve the quality of treatment.
Man empfindet eigentlich nur.
One feels very frightened. There's a great void. The questions keep repeating themselves. What now? What's going to happen now? Is this the end? I think every cancer patient thinks that when they receive their diagnosis.
Und ich habe nicht beschlossen, etwas.
And it's not that I've decided to create something that will outlive me, rather that I want to try to set something in motion that will continue.
Auf den Weg zu bringen, was weitergeht. Also die Familie, die haben
My family helped me in every way they could. My brothers and sisters, my children, my husband, they were always there. I was never alone. I talked about it a lot. And when you talk about it, I think, it makes it easier. It's better to talk about it, not always let it eat away at you and say, I don't want to talk about it. When you talk about it, it's much better than when you don't talk about it.
It was actually more my mother who would talk about it. She brought it up time and time again. You don't need to be afraid, I'll make it. And that would reassure us because we knew, okay, my mother is strong, and when she goes at it like that, it's just got to turn out okay.
1995.
In 1995, my wife Katrin came home. She'd been at the gynecologist, and he had diagnosed a tumor on the ovaries. In 1999, she had her first recurrence. Basically, it went on like that every year. She had 8 operations, and then she died in 2005. For my part, I suffered a lot, and then I said to myself, I'm sick too. My diagnosis is a wife with cancer. What exactly is ovarian cancer? How does it begin? The ovaries are located in what's called the lesser pelvis. That's the lower part of the pelvis. Looking from the front, one first sees the bladder. Behind that, the uterus with the fallopian tubes on either side. At the ends of the fallopian tubes are the ovaries. Once a month, in a sexually mature woman, the ovaries release a mature egg, which travels to the uterus through one of the fallopian tubes. The ovaries also produce the sexual hormones estrogen and progesterone. In ovarian cancer, the cells of the ovary become abnormal and grow uncontrolled. The growth becomes a visible cancer node, also called a tumor. When the tumor reaches a certain size, it can be detected through computer tomography or ultrasound. How long it takes until it reaches this size can vary. Sometimes it even takes a few years. Unfortunately, the symptoms of ovarian cancer don't appear until relatively late on. By the time a CT is done, the tumor is usually already fairly large.
I didn't have any symptoms. That was the worst part about it, actually. There weren't any warning signs. I had checkups regularly. I had gallstones, and I'd had a bilious colic, so I was going to a doctor for that. And it was through those examinations that they discovered the cancer.
Screenings are important, but they can't always detect every case of ovarian cancer in its early stages. Blood tests to determine the level of CA-125 are also not 100% reliable. This tumor marker is generally used to determine a woman's response to treatment, rather than as an early detection procedure for ovarian cancer. At first, when cells in the ovary become abnormal, they're confined only to the ovary. If the tumor grows larger, it can then spread to the abdominal cavity, first invading the abdominal wall. The abdominal wall is a kind of thin skin, a membrane which forms the lining of the abdominal cavity and covers all the abdominal organs. It's also called the peritoneum. One can imagine it as a sheet covering the abdominal cavity from the inside. It's also wrapped around the organs, like the intestines, thus allowing the organs to move smoothly within the abdomen. The greater omentum, an apron of fat which serves as a layer for the abdominal organs from the front, is also surrounded by the peritoneum. The best way to try to visualize the peritoneum and its reflections is to examine a cross-section through the abdomen. One of the peritoneum's important tasks is to regulate the release and absorption of fluids. The ovaries, too, are covered by the peritoneum. If the tumor penetrates the ovaries, it can reach other regions of the abdominal cavity and invade other organs, like this intestinal loop. Cancer can also originate in the peritoneum itself. Peritoneal cancer is very similar to ovarian cancer and is treated in the same way. If the abdominal wall is invaded by cancerous cells, its fluid cannot drain properly through the lymph system. At the same time, because of the cancer, it produces more fluid than normal. When this fluid accumulates in the abdomen, it is called ascites.
I just kept getting fatter, and eating less wasn't helping. I felt bloated, and if I ran, I could feel this gurgling in my tummy. And I thought, something is wrong.
The cancer cells can also spread via the lymph channels. They collect on the lymph nodes. This is known as lymph node metastasis. It's important to bear in mind that each resettlement of cancerous cells involves only cells of the ovary. This also holds true for affected lymph nodes. Therefore, the same cancer therapy is used for any involvement of other organs as for the primary cancer of the ovaries.
Die Grundpfeiler in der Behandlung des Eierstock-Krebs.
The keystones in the treatment of ovarian cancer are surgery and chemotherapy. Surgery aims to both confirm the diagnosis and to determine the extent of the tumor. I can do this much better when I can see the organs with my eyes and feel them with my fingers, as I can with ultrasound or a CT. In addition, the main goal of an operation is to remove all visible tumors.
Alle sichtbaren Tumoren zu entfernen.
To ensure that as little cancerous tissue as possible remains in the body after the operation, not only both ovaries, but the fallopian tubes and the uterus are removed as well. The hormones produced by the ovaries will now be supplied in tablet form if needed. Often, certain lymph nodes and parts of the abdominal wall are removed, as they too are frequently cancerous. These organs are relatively small, and any space left by their removal is easily taken up by the intestines, so there is no hollow cavity left over. In a routine procedure, the omentum is also removed. Its absence has no serious consequences. To the contrary, it is often the site of resettled ovarian cancer cells. Should the cancer have invaded the intestines, the affected part of the intestine will be removed. In some cases, an artificial intestinal outlet is necessary.
As expected, the operation itself was a major one. That simply can't be avoided at such an advanced stage. But then every day things got a little better, so that I could say to myself, look, yesterday you couldn't do that. And the day before yesterday it didn't even occur to you to do that. And so these little successes really brightened things up and helped me keep practicing and keep going. I mainly drew strength from people where I had the feeling that they had made the effort to operate on me, to treat me. That gave me strength. And in my private life, I really got a lot of strength from the desire to fulfill the normal route of hereditary succession. To see it through. To still be alive when your parents pass away.
Of course, there was tremendous fear. I was horribly afraid of having pain. But it never got that far, because with today's medicine, thank God, you can pull through something like that relatively free of pain.
dass man relativ schmerzfrei sowas überstehen kann.
After the operation, to ensure that any remaining tumor cells are destroyed, most women undergo what's known as chemotherapy. Usually, medicines are injected directly into the bloodstream, always in combination with other medicines used to prevent nausea and vomiting. The substances are intended to destroy or to inhibit the growth of tumor cells. To do this, special medications have been developed which are particularly effective against ovarian cancer. Then, after a day or two, they usually pass through the kidneys and are eliminated. Unlike normal cells, cancer cells reproduce very quickly. That is the decisive point of attack for chemotherapeutic drugs. Intestine and bone marrow cells also divide quickly. This is why side effects may arise, but these days they can be easily treated. Chemotherapy can also find individual straggler cells and render them harmless. That makes it so important. Many women ask, why do I need chemotherapy? Despite the operation, tumor cells can remain. Even after all visible tumors have been removed, single tumor cells can still be present in the abdomen, which, without targeted therapy, could grow into larger tumors. That's where chemotherapy becomes necessary.
Clinical studies show us that chemotherapy today is more effective and better tolerated. Nevertheless, side effects do occur, which can be treated preventively or relieved through modern drugs. Among these are drugs against nausea, which are given to every patient before chemotherapy to reduce or even prevent feelings of sickness. When during the second chemo my hair fell out, I went into the bathroom and all my hair came out. And I just closed the door and didn't want to talk to anyone. And then, at some point, my daughter Julia and I found the right wig. And we bought it. And that was such a relief.
She has to feel good with it. We can tell her all we want, how good it looks, or it looks like her old hairdo. Doesn't mean a thing to her.
I thought hair doesn't matter, it grows back. The main thing is I'm doing well. And I just waited until my hair gradually grew back naturally.
Chemotherapy is very effective against ovarian cancer. Ovarian cancer is one of the cancers most treatable with chemotherapy. And it's been clearly shown that the use of chemotherapy can significantly increase the chances of survival and improve long-term results in the treatment of ovarian cancer.
After the second operation, which went very well, I had the assurance that things are looking good, they recommended that I do a second chemotherapy. And my first reaction was kind of, oh God, all that again. But because of the studies that have been done in the centre, with a worldwide network, I was told that there's a new chemotherapy drug that's easier to tolerate. That convinced me. I thought, okay, if it really does have fewer side effects, that would be wonderful. And in retrospect, I can say it was far easier to tolerate. The successes and advances so far in the treatment of ovarian cancer could only be achieved through research. Similarly, a study in Germany shows that centres that participate in studies offer a clearly higher quality of therapy for ovarian cancer patients. That means that patients who take part in studies profit from them.
In addition, every patient does a service to others stricken by the disease. Participation in such a study is, of course, voluntary, but it supports the patient's desire to do something against the illness. Heidi Liebert has also taken part in several studies. Since her second relapse, she's been receiving continuous chemotherapy in the course of a study. She's arranged her life in congruence with the illness and her therapy. Before, other things stood in the foreground.
My friends always told me, "You're trying to do everything at once." I liked to party, I smoked, drank red wine. I didn't listen to myself. I just rode around on my own motor of life, without looking to see whether anything might have to be refueled. I see that I can totally relax. Before the illness, I felt like my body was more like a wrapping, and I never gave a thought to anything. Now, through the meditation, I can feel my organs, and I can tell when something's not right. I can tell that right away. It had been brewing in me for some years. But in a way, this illness has gotten me on the right path. And then I realized, okay, the illness is a chance. With the work I'm doing now, I found a way to just take my time. The fact that I determine my own schedule helps. And when I'm not feeling well at all, then I take the whole day off and see to it that I'm doing better the next day.
Follow-up means that after completing treatment consisting of surgery and chemotherapy, the patient still makes regular visits to the doctor. The doctor does a physical and gynecological checkup intended to detect in time any tumours that may return. But it's very important to see the follow-up as a comprehensive concept, and especially as care for the patient. If, for instance, the patient is still having trouble, if she's feeling tired or is in pain or has other symptoms, further treatment or a rehabilitation period may be arranged.
It can happen that I go in and don't notice a thing. Nothing's going to happen and I'm completely calm. It can also happen that I go to a follow-up examination and haven't slept at all that night because I can tell something is not right. So these follow-up examinations are a risk. But I know I've got to go. It's for my own safety. So I go and face it.
Despite surgery and chemotherapy, with ovarian cancer, tumors can recur. But even in this situation, we can today discuss with the patient various possible treatments. Which individual strategy is chosen depends on various factors, like one's general condition, the interval between therapies, and what difficulties she's having, for instance.
Und nach der Krankheit, wie ich
And
gehört
after the
habe,
illness, I heard sport is good. Sport gets you fit.
Macht einem fit.
Dann hat man auch gemerkt, also da habe ich zumindest gemerkt, dass meine Mutter schon immer...
And then I noticed that my mother was getting fitter and fitter, that all this working out had gotten her in a such good shape that she was sometimes fitter than I was.
Oder wo sie dann morgens ins Zimmer kam und meinte, aufstehen, wir gehen jetzt joggen. Wo ich mir dachte, oh nein, nicht schon wieder. Also hat man gemerkt, das macht ihr Spaß. Und dann habe ich mich ja, mehr oder weniger gezwungen, das auch zu machen. Und hat eigentlich gut geklappt.
Mein Pferd, den habe ich nun...
I got my horse Lord in 1989. He was 11 years old.
bekommen. Da war er 11 Jahre alt.
So we shared many years of good comradeship together.
Viele, viele Jahre
He meant a lot
gute
to me.
Kameradschaft gehabt. Er hat mir sehr viel bedeutet. Aber dann wurde ich krank.
But then I got sick, and that wasn't possible anymore.
Aber ich habe viel früher angefangen.
I began going out again very early on, because I didn't want to leave him alone. And I could tell that the horse was happy when I came. We played, and of course I had to groom him and check his hooves. I had a task.
Ich hatte eine Aufgabe. Und das hat mir, glaube ich, doch sehr
And I think that helped me a lot, because I couldn't just let myself
konnte mich
go.
nicht gehen lassen, ja. Ich hatte, wenn das Wetter
When the
gut
weather
war
was
und
good and when I wasn't having any intense dizziness attacks, I didn't really have an excuse not to go out, even if I was feeling weak.
obgleich ich mich schwach fühlte. Und das, glaube ich, das
And
war
that was a
eine
wonderful
wunderbare,
support. Because being out in the open, natural surroundings, in the company of these animals, so noble and good,
und so gut.
well, that's therapy for the soul.
Eine Kur. Das ist eine seelische
It
Kur.
was something that I did for
Die habe
myself.
ich mir dann einfach dadurch
I talked
gegeben,
myself into it by
weil ich mir
saying,
eingeredet habe,
Lord
der Lord
needs
braucht
me,
mich.
I must
Ich
go
muss
now.
kommen. Ich
My
erwarte,
horse is
dass ich
waiting
ihn
for me to
besuche.
visit him. But in the
Aber
end, it was really just good for me
war
to
das
go
nur
out
gut für
there.
mich, daraus zu fahren.
Mitzuteilen, ich habe auch keine Probleme bis auf
Ich möchte mehr darüber wissen, über meine
I want to know more about my illness. I'd like to have more material. I'd like to hear what people have to say who have gone through this situation themselves. But I'd also like to learn from experts. You can get lots of information from self-help groups, different things than just from asking around in your circle of friends.
nur im Bekanntenkreis herumfragt. Die Gruppe kann nur etwas leisten, was vielleicht
The group can do things that relations can't do, because the relations are so closely involved.
sagen wir mal, bringen können, weil sie zu
With
betroffen
more
sind.
distance, yet with sympathy, even compassion, a group can put things into perspective.
Doch mit Anteilnahme diese Situation, naja, sagen wir so ein bisschen relativieren.
Der Mensch, der krank ist, der verändert
A
sich.
person who's sick changes, and he doesn't notice it at all. He just changes. I came up with a term once, the diktat of the ill. It was clear to me that if you submit to the diktat of the ill, you lose. You'll fall ill yourself. You've got to assert yourself. And when I finally realized that, I got help from a therapist, because I saw that I couldn't handle it alone anymore. I longed for a space. I learned that in therapy. And then I was happy. I had my little atelier, and I could pursue my painting. I had a good feeling. Katrin was right underneath me in the bedroom. And she was happy too when she came up and saw what I had painted.
And
that, in turn, gave me strength to create my own space where I was all by myself. I was also in a sports club, so somehow I could deal with it all. Yeah, deal with it all, you could say.
Schaffen kann man sagen.
No, the time of the illness wasn't bad. It was a struggle. We struggled together with a high quality of life. We traveled a lot, we did a lot. No, our love didn't get any stronger, but it was a love right from the beginning. And if I look back today, yes, I'm strong now. It makes me strong that I had a love like that.
Up until my illness, until I was 38, I played many trouser roles, where a woman plays a man or a boy. After the operation, which in my case was on my tummy, and after my recovery phase, with my voice back in shape, I discovered a completely new sense of my body.
Ein vollkommen neues Körpergefühl entdeckt. Obwohl man jetzt vielleicht
Although one may say that medically I am not as womanly as I was, I would say that for myself I am. I believe I have become more womanly and more self-assured.
Selbstbewusster damit geworden. Ich glaube, dass die Stimme, die ich jetzt habe,
I think my voice has become more womanly. My repertoire more womanly, because I can sing more womanly roles.
Sie ist, glaube ich, etwas robuster.
It's become more robust, to put it positively, a bit more sturdy.
Belastbarer. Das war ein längerer Weg.
It's been a long journey, but I think I found a second voice.